I'm not a specialist, I'm a GP. I'm not clever, I'm not an academic. I'm just a country bumpkin, really. So I wanted to talk to you about sheep, because I wanted to make it Welsh as well. And the Good Shepherd is a very old-fashioned, it goes back many millennia, the idea of the Good Shepherd. And I want to talk about where we fit into all this. Are we sheep? Are we sheepdogs? Or are we shepherds? I found out about this on late Thursday, early Friday. I was doing this slot. So I talked about what happened at work on Friday and perhaps show you how complex it really is. And that's going to feed into our 3 hallmarks of trust, communication, and person-centeredness. And I want to talk about some ideas of where we feel that locus of control is when we're doing our day-to-day work. So this is, I'm not going to go through all these patients. I'm going to stick that up there, all right, for you to look at. This isn't an extraordinary morning surgery for a GP. It's probably extraordinary because there actually were not many people on this particular morning. I was working in our branch surgery, so it wasn't quite so busy. You can see dealing with a mixture of physical problems, lots of them with mental health components, mental health problems with large physical components, and nothing particularly easy apart from, luckily at the end, an extra came in. It was Friday, and a child with chicken pox where the spots got infected, and I thought, phew, thank God for that. I went off to do some visits at lunchtime. I have taken on the responsibility of looking after a nursing home which specialises in mainly elderly people with dementia, and most of them with severe behavioural disturbances. And I felt very strongly that this was a very vulnerable group of people. And what we used to do is a different doctor, and nobody wanted to go, different doctor went every day to see 1 or 2 patients, and I try and get them to collect them all together. And I know the patients now, so I know a bit of that, their past history, I know their names, I can know what they're normally like. And as you can see, some quite complicated stuff again, and this was all in 3/4 of an hour over lunchtime. And the last one was a dear gentleman who'd been sent home from hospital. He got a leaking aortic aneurysm, which was inoperable. They kept him in hospital, and his wife said, can't he go home to die? So he came home to die, and he actually died on the early hours of Saturday morning, looked after by his wife. Very sad, but he was 90. He was fully aware of what was going on, and he gave me a wonderful beaming smile on Friday afternoon when I saw him. Then afternoon surgery, it's a bit like morning surgery, really. The 3rd patient down took me half an hour, and I've been working with this patient for about 18 months trying to get her trust. And I'd refer to the CMHT, she'd agreed to go and then wouldn't go. But eventually, I think, hopefully, she's had an assessment this week. We talk about the hallmarks, and it all sounds wonderful, doesn't it? And it's ever so easy, we just need to do it. But I think there are significant barriers in actually doing things well. And I'm just going to run through these because I think they'll all be fairly self-explanatory. They're more than this. This is just what I came up with over the weekend, and you could stick in the GP contract into that if you really wanted to. Exhaustion and burnout, and this is where I'm coming to, because you sometimes as a GP, and I'm sure we all do it in our own working lives, you actually sort of almost think, I just can't cope with any more of these. And I think we sometimes don't recognise that enough. I actually did get very burnt out as a junior doctor, and I swore to myself I would never, ever go there again, because I was a crap doctor, I really was. Because I looked at my clock and I thought, it's 5 o'clock, nobody's paying me anymore, I want to go home. And I don't think you can be a good doctor when you do that. So where do we feel the control lies in all this? We look at that list above us, and it's all things out there. It's other people's attitudes, it's the money, it's what people expect of us, it's the people who keep coming through the door, and we think we don't have any control over all this. And what I'm trying to get to is the fact that we feel like a sheep in all this, that we're being pushed around. And I don't think that's really necessarily quite as true as we let ourselves believe. But the hallmarks can work, I do think. But we need things to help them work. We need extra time. There's an article in the British Journal, in the BMA, in the BMJ, a couple of weeks ago, GP in Scotland had met some GPs in Sweden. They were consulting on an average consultation time of half an hour. He just fell over backwards and said, wow. And this guy said, and this Swedish doctor said, how can you work in 10 minutes? You know, and you think that it wasn't so long ago, a lot of GPs were working in 5-minute slots. 10 minutes isn't enough, but that means if you're going to consult at 15 minutes, at 20 minutes, there's a resource issue there. You're going to need more doctors. I do think we need recognition and respect. Primary care in Wales is incredibly popular with patients. The satisfaction rates are well over 80%. In some practices, you're getting sort of satisfaction rates of 94%. Now, our political masters would be lucky if they hit 20 to 30%. Yet we're seen as somehow bedeviled. And I think we do need loving every now and again. And sometimes you read that, you pick up the newspapers, you look at the websites, and you think, well, that's not how it seems when I'm working. I think we do need to make sure we get continuity of care, and we do need support and resources and training. And wamhinpc is part of that. I don't think we can do it all, but I think that's a huge part of what we would like to do. I think inside us we need to believe. We need to believe that it actually does work, that we do actually have a role, that we do actually sometimes do it quite well, and that it's actually very, very important. This is an important thing about getting evidence. Actually, when you're looking at person-centeredness, which is one thing I wanted to talk a little bit about, is there actually is very good evidence that person-centeredness actually works at a practical level. And that's research that is going on in Cardiff. Professor Glyn Elwyn has done a lot of research in his department looking at the benefits of a person-centered approach. And it does work. People get better, they use services more appropriately, and the doctors feel better. So it's a win-win, but it's incredibly difficult to do. And then the cynics say, well, how do you know it's working? I mean, what's the evidence? Well, we did a survey which went out unannounced to primary care staff across Wales about 2 years ago. And we actually had a very dramatically good response, which I think was around about 25% return rate, which wasn't bad for cold calling. And we're going to redo that survey, and that's going to go out this autumn. So if it comes across your desk, please do answer. We're hoping that we can show already there is a shift in attitudes and people's comfort with what they're doing and the roles they have to participate in. So that will be some evidence that it's working. We can talk to each other. Don't spend much time actually talking to each other, do we? And saying, how is it for you? I think we need to spend a lot of time listening to patients and how it's for them, because at the end of the day, they're the most important person at the centre of all this. There'd be statistics could show us it's working, but I'm very sceptical, hence the 2 question marks. I think it's going to be extremely difficult to show with numbers actually that we're making effect when we're really talking about quality, which isn't perhaps a numerical concept. We can look at the journeys our patients go on and seeing if they're perhaps a bit more thought out, a bit more patient-centred, a bit more sensible for them. Because sometimes, and we all know, all of us who work in any healthcare setting know that sometimes these services and the journeys that people go on to navigate through to some sort of sense of wellness are just nonsensical, actually damaging at times. But I think we have to live with the reality that perhaps we're never going to really know whether how much we've made it better. And we have to live with that uncertainty. But I would wonder whether our political masters and our paymasters can live with that uncertainty. And can we make a difference as individuals? Are we the sheep, or can we do something about it? Well, I think you can do things about it. We're all here. We can do things about it. All right? You can be parts of wamhinpc, and you can use us, and we can use you. I think you can make a difference by how you think and feel and work. And I think it does make a difference on a holistic basis. The third point, we're a training practice for GP registrars, and part of my role as a GP trainer is to look at video consultations, which our GP registrars do. And one of the things that is part of their training or trying to do is get them to consult in a patient-centred way. And so I'm sitting there being very critical, and so I'm picking them up and saying, well, perhaps you should have asked some more open questions there, or perhaps don't you think you missed that hint there? They went a bit quiet, or they looked at their shoes. Do you think there was something they hadn't said? And then at the end of the teaching session, I go away and thought, I'd have done all this exactly the same thing as he would have done. I think it's a constant challenge that we need to be saying to ourselves, am I being patient or person-centred enough? Because I think it's actually incredibly difficult, and we are trained to be non-patient-centred as doctors, and it's incredibly difficult, I think, to put yourself in that mode and keep yourself in that mode, all right, throughout a busy morning surgery. I think we need to help each other. If we come across a colleague you think has done really, really well, how often do you say, well done? That was really, really good. I think, how often, do you get feedback if you've made a referral? That was I've talked to the patient, they were really actually grateful for what you did. I think there's not enough of that going on within the health service. It's actually saying, we tend to speak up and do things when things go wrong, and we don't recognise when things go well. And I think this has worked for wamhinpc about how many of my colleagues see mental health and mental well-being as an important part of their day-to-day work. That's a huge challenge, I know, and I hope it's getting better. And I've had a sneak look at how many GPs have turned up to today's conference, and it's encouraging more than before. So perhaps we're winning. But I think that's a huge, huge piece of work. So my argument is we're not actually sheep in all of this, that actually there is a locus of control which is within us, that we can actually do things the way we work in our day-to-day work, which makes a difference to people. But it's actually hard work, and the things are stacked up against us. But we've got to keep doing it, all right?